Hi, I'm Emily. I'm a senior here at Penn State and I'm doing my final presentation on Wernicke's aphasia. I will conduct a narrative review on this rare language disorder and analyze its effect on cognitive health and the quality of life in individuals. Learning about traumatic brain injuries is extremely important because they are the leading cause of death and disability in children and young adults. Also, they are a major concern for the elderly because they result in a copious amount of hospitalization stays due to falls, especially for individuals aged 75 and older. Traumatic brain injuries have the ability to severely impact one's quality of life in ways such as impairing thinking, decision making and reasoning, concentration, memory, movement, and impairing the senses such as vision and or hearing. In 2010, the U.S. Centers for Disease Control and Prevention recorded that brain injuries were a factor in over 50,000 deaths in the United States. Over 280,000 people with traumatic brain injuries were hospitalized, and 2.2 million individuals visited the emergency room due to traumatic brain injuries. Not all brain injuries are similar, and they impact individuals in various ways. It's important to learn about these injuries so that their long-term effects can be assessed and better treatments and therapies can be formed to help the affected individuals. Wernicke's aphasia is a language disorder that arises after an individual experiences brain damage. In most cases, aphasia develops after a stroke occurs in the left temporal lobe, which is the language comprehension region of the brain. Once this region of the brain is damaged, auditory verbal comprehension is significantly impaired. The core elements of the phonological and semantic systems that are intact during language comprehension are affected, and spoken language comprehension is most significantly impaired in Wernicke's aphasia. Individuals will speak in long and complete sentences. However, their sentences will not make sense. The sentences produced by individuals with this disorder are meaningless and include many unnecessary words and made-up words. People with this disorder are unaware of the mistakes they make with language. There are 6 forms of aphasia: global, Broca's, Wernicke's, primary progressive, anomic, and mixed non-fluent aphasia. Wernicke's is distinguishable from the other 5 because it is characterized by an individual speaking fluent gibberish. It's fascinating to me that an individual with this type of aphasia is completely unaware of his or her language problems. They are oblivious to their own lack of comprehension, even though the rest of their cognitive ability and reasoning skills are still intact. Individuals also do not have the ability to properly comprehend anything that is said to them or anything that they read. Their overriding main deficit is their lack of phonology. The 2 main risk factors for aphasia to occur are older age and damage that affects one or more of the language barriers of the brain. Brain damage can arise from a brain tumor, stroke, brain infection, and progressive neurological disorders such as Alzheimer's disease. Wernicke's aphasia usually occurs suddenly following a stroke or other brain lesions. However, it may also progress slowly because of a brain tumor or a progressive neurological disease. There is a positive correlation between the severity of Wernicke's aphasia and the amount of damage within the Wernicke area. As defined by Bogan and Bogan, the Wernicke's area is known as the area where a lesion will cause language comprehension deficit. This language comprehension region involves large regions of the left temporal and inferior parietal lobe. Throughout my paper, I will also address the large disconnection paradigm in language and Wernicke's aphasia. There is a disconnection in the brain involved with this disorder. A lesion will spare the visual cortex. However, its involvement with white matter outputs will result in visual sensory images becoming disconnected from other brain areas. This consequence is referred to as visual agnosia, which means that the ability to visually perceive an object is preserved, but the visual percept would fail to elicit the wider associations required for recognition. A significant correlation was found between comprehension and the amount of temporal lobe lesion in the Wernicke's area, but there was no correlation between comprehension and total temporoparietal lesion size. Patients with over half of their Wernicke's area damaged from a stroke will continue to have poor comprehension a year later. However, patients who had half or less than half of their Wernicke's area damaged from a stroke will have good comprehension skills 6 months after the onset of their stroke. In my final 2 paragraphs, I will discuss the effect of Wernicke's aphasia on quality of life and available therapies for this disorder. No medicinal treatment is currently available for Wernicke's aphasia, only therapy treatment. The current trends in aphasia treatment range from traditional approaches to cognitive neurolinguistic approaches and functional approaches. Aphasia therapy is functionally oriented and focuses to improve the communication abilities of daily living. It helps individuals with their language skills and teaches them new communication strategies they could use with their friends and family. Also, this sort of therapy encourages the mindset for people with aphasia that they should continue to work toward real life goals. This helps them jump back into life and re engage in interactions with people that relate to authentic experiences. Each healing goal is specifically made to fit each individual's needs so that each individual has the best outcome. Language disorders like aphasia have a profound effect on an individual's quality of life. The inability to use language properly creates a burden on an individual and causes emotional distress, depression, and social isolation. Also, their poor lack of language communication has a profound effect on the job status of an affected individual. To gather information for my narrative review, I use scholarly journals such as PubMed, Google Scholar, and the National Center for Biotechnology Information. Majority of the information that I gathered for this project was published relatively recently, since 2014 or later. There were only two articles that I utilized for my report that weren't as recent, one being from 2005 and the other from 1987. Although these articles were not so recent, they contained a lot of valuable information that I was able to use for this report.